So I think the key thing here is that if a bunion doesn't hurt, it doesn't need surgery, okay? So we treat bunions when they hurt, and they can hurt in many ways. They can hurt because they rub on the shoe, and they get inflamed, and they can become very tender over what we typically see that big bump on the inside of the shoe. But also, they can ache within the joint, and sometimes people, for example, say they come home and they're just desperate to get the shoes off because the feet are just throbbing. It's not an agonizing pain, but it's just a discomfort that just doesn't go away. The other thing is you can sometimes get numbness in the toe, which is quite unnerving for patients because the nerve gets squashed between the bone and the skin. So the nerve gives them a bit of tingling in the tip of the toe, and that can be quite unpleasant. But sometimes what happens is because your foot's so deformed, you start getting problems with the other toes. So for example, you see people get claw toes or hammer toe deformities where the other toes start to hook up. That can cause problems. Sometimes you can get things like a stress fracture or inflammation in the joints. So these are relative other indications to do something about your bunion. If your bunion hurts, and if you leave it too long, you develop other problems in the foot. We get very good results when we are just treating the big toe. But what we know is that when we have problems with the lesser toes, for example, when those lesser toes are getting inflamed, or people are developing a kind of a claw-type deformity, a hammer toe on the other toes, the surgery results are never as good. So you really do want to, if you can, nip the problem while it's just isolated to the big toe.